through it that you refer to a number of documents, emails, papers that you drafted and so on. I think it's right to say that you came across some obstacles in obtaining material that you needed for your witness statement. Could you tell us something about that?
I did, and I want to be quite careful because I think that, you will have heard already that it's very easy to bash a government department. And I'm not, when I'm criticising the Cabinet Office, blaming particular individuals, I should say, very much not. But it has been extraordinarily difficult to get even the most basic pieces of information to be able to serve the inquiry properly. So I feel like I've had to be my own forensic archaeologist of my time in 2020, and it's been hard enough for me to work out what was happening when, and I was there. Because of the difficulties with accessing documents, accessing the right information, and because unfortunately the Cabinet Office deleted my work mobile phone, so I've not had access to those records either.
And we'll come to one or two parts of your evidence where you say you're sure that there were relevant WhatsApp messages and so on that you sent, but you no longer have them because you returned your phone to the Cabinet Office when you left, and they have been unable to provide it back to you. And I think they've told you that is it the phone itself that's been destroyed, or has the material been deleted? I'm not entirely sure, although I definitely did ask, because I know that the messages were all backed up. I asked if they could provide a kind of, I'm going to use the wrong word, but like a simile of the phone so that I could at least see the messages, and that wasn't possible either. I should reassure the inquiry that most of my business, as you would expect, is on email, and most of it is all captured in the public record. So I don't worry that there's a huge amount of material that you're not seeing, which is relevant to the work that I was doing. But nonetheless, a frustration that the phone messages weren't available. It is, yeah. Let's move on, Ms MacNamara, and I want to start, as you do in your statement, although I want to take this part reasonably briefly, with the question of how ready the government machine was for the pandemic, which developed from the start of 2020. And what I'd like to do, if I may, is go to paragraph 23 of your statement on page 12, which is your summary at the end of this section of your witness statement, where you say this: in summary then, when COVID arose as a concern in January 2020, the UK government was already on the back foot from another once-in-a-generation event. Key parts of the system were either subject to change or might have been and were awaiting clarification. Many ministers, senior civil servants and special advisors were uncertain in their role. There was no clear business-as-usual pattern of working with Mr Johnson. The Cabinet Office and Whitehall had developed some unhealthy habits in terms of ways of working, and it was a low-trust environment in terms of relationships between the civil service and the Prime Minister and his political team. So just to pick up on a few of those points. First of all, the once-in-a-generation event that you refer to was Brexit. Yes. Now, some other witnesses have made the point that, at least in some respect, the experience of Brexit, and in particular the preparations for a no-deal Brexit, were valuable as a precursor to the experience of the pandemic. First of all, do you agree with that? And secondly, if so, what is the wider point you're making about the, if you like, deficit of the Brexit experience? First, yes, I absolutely agree that the no-deal preparations and the experience of doing the no-deal preparations was immensely valuable. And actually, in retrospect, it's one of the frustrations when I think about whether I should have been more reflective at the time, that we knew how hard that had been, how unnatural it had been for Whitehall to have to think across a whole system and think about things we weren't practiced in doing, and work collectively across a huge range of operational and policy areas. And it had been very difficult to start off with. And then over that preceding year, and actually to give them credit, to a large part when Boris Johnson became Prime Minister, the team had really focused very hard and done an enormous amount of good work that did stand us in very good stead. But we sort of somehow hadn't clocked that
that we were kind of 2 years previously on COVID, if I can use that as an example. So yes, but the wider deficit, I think, is partly I should make the point, this is nothing to do with whether the country decided to leave the EU or not. My point is entirely about the Whitehall and Westminster response, and particularly the Whitehall structures had been bent out of shape by a series of things that had happened. So the business as usual model of the Cabinet Office that lots of people who worked in the centre of government would recognise, which wasn't really there for all sorts of reasons in January 2020. There was also, when I talk about uncertainty, which might be the most useful point in here to highlight, there hadn't been a significant cabinet reshuffle after the 2019 election. The election had fallen right at the end of December, really, and the Prime Minister had wanted to take some time and to consider some quite substantial machinery of government changes, potentially, before deciding who to put in which cabinet jobs. So this period, and I think the reshuffle then came quite late into that February. It was the Friday before the House rose for the half-term recess. So there were an awful lot of people who weren't sure what jobs they had. And this is particularly uncertainty on the political side, obviously, but also on the civil service, given the potential for large amounts of machinery of government change. And I think it's been mentioned before, but there was, again, a lot of hostile briefing about the civil service, which was making people feel uncomfortable. And at this time, there was what was happening in the Home Office with the then Home Secretary and the Permanent Secretary.
That's a reference to the falling out between Priti Patel and the Permanent Secretary, Mr Rutnam.
Yeah.
And that's an issue that you yourself were asked to take some role in. You investigated allegations of bullying, and that was something that was going on at very much this time.
Yes.
You mentioned there also, you say there's no clear pattern of working with Mr Johnson. This is something we'll come back to, but was that an extraordinary matter?
That's a very good question. I'm not sure whether there would ever have been a normal pattern of working for Mr Johnson, but I do know that the kind of monomaniacal focus of him and his political team, for reasons which I'm sure that they would happily give, on just focusing on EU exit from July 2019 and then getting to the election, meant that they, at least in the way it was communicated to us, everything else could wait till after this question was settled, and then there was going to come a very large amount of change, and we were just not sure what that change was ever going to be.
And just going back to the beginning of this paragraph, these are all matters that you say contributed to this sense of being on the back foot at the beginning of that year, and that was one of them, was it? Yeah. And lastly here, you talk about unhealthy habits that had developed in the Cabinet Office and Whitehall during the previous period. Was one of those the sense of bypassing cabinet government?
Yes.
Well, I think I won't ask any more about that. I'm going to come back to that in due course. Let's move on, Ms MacNamara. I want to ask you then about those early months of 2020 and the emergence of the pandemic. The inquiry has now heard a lot of evidence about what took place in January, February, March of that year, the developing understanding both of the scientists and people at the centre of government of the virus, SAGE meetings, COBRA meetings, and so on. Can you just give us an insight into how the pandemic impinged on your own work as you went about, no doubt, many other things in the Cabinet Office in that period?
Of course. So we're obviously aware that there was this emerging problem. Probably the most visibility I personally had of that was via the Cabinet Secretary's Monday morning meetings. So, as I suspect is normal everywhere, he'd gather his top team together and we would cover what was happening. And so that was the place that from very early in January, I remember first hearing about the response to the virus, which was very much framed as an international rather than a domestic problem at that point. And then I occasionally attended the morning meeting on behalf of the Cabinet Secretary. So this is the Prime Minister's daily meeting. And I would have picked it up from there. And then obviously in the Cabinet, so as well as being somebody who could see what was happening in the world, yeah. But in the Cabinet Office, that's where I first understood what was happening.
And just to be clear about this, we've already established what your role was. You've told us of at least one other thing that was taking up your time during that period, the issue around Priti Patel and her Permanent Secretary. But we shouldn't get the idea, should we, that it was part of your job to deal with COVID. You were at a higher level than that, overseeing the entire work of the Cabinet Office. Is that a fair way of putting it?
Sorry, this is probably going too much into civil service structures. There is a separate Permanent Secretary of the Cabinet Office. What I was overseeing was the kind of old-fashioned operation of government. I wasn't ever responsible for any of the teams who were preparing for or running crisis response or any of the... I had no direct line management over any of these teams, no.
Yeah. But as you say, in the course of attending these meetings and no doubt simply being in Downing Street in the Cabinet Office, you certainly became aware of the pandemic and the way in which it was being treated.
Yes.
And I'd like to take you to just a couple of references in your statement about this. First of all, if we may, paragraph 24 of your statement, which is on page 13. And here you are discussing that part of your role which involved drafting briefs for the Cabinet, for the Prime Minister, for his Cabinet meetings. And picking it up towards the bottom of that paragraph, about 6 or 7 lines up from the bottom, you say, in practice, in this case, the tone of the Cabinet briefs on the coronavirus, and in particular the injections of caution I made about the uncertainty of the picture, did not register with Mr Johnson. He rarely referred to the brief. In those early Cabinet meetings in particular, Mr Johnson was very confident that the UK would sail through, and we should all be careful of overcorrecting in advance of something that was unlikely to have a huge impact, and for which, in any case, we were well prepared. Just to get the timing clear, at the beginning of that paragraph, you say we're talking now about January, February. And was that your experience of Mr Johnson's early approach to the disease?
Yes, and it was a pretty confident climate in general, so it wasn't unusual for the message that we were going to be great at it to be the kind of general overriding message of anything that was brought before the Cabinet.
Just pause there, because there's another passage I wanted to ask you to look at, which is on page 15, it's the last few lines of paragraph 27. I think this really picks up the point you were just making, Ms MacNamara. Now you're talking about being at not the Cabinet meeting, but the early morning meetings. And you say, during this period, 4 lines from the bottom, the atmosphere and discussion in the morning meetings, I intended, was confident and macho. This in itself was not a new thing, but it seemed even more so than usual. We were going to be world-beating at conquering Covid-19 as well as everything else.
Yeah.
What do you mean by that?
Well, just that it was striking that something that I felt personally was obviously deeply worrying, that there was a sort of de facto assumption that we were going to be great without any of the hesitancy or questioning or that sort of behind closed doors bit of government, which isn't about saying everything's smashing and going brilliantly, but actually being a bit more reflective and checking that everything's going to be quite as great as we'd like it to be. And that tone, in my observation from these discussions, was just completely and utterly absent.
And just moving on, further down this page at paragraph 29, you refer to one particular incident, which obviously was one that you remembered. Now we're in early March, and in fact you've linked it to the day when there was an issue about the Prime Minister shaking hands at a hospital, which we know was the 3rd of March, so you're right, it's early March. And picking it up about 5 or 6 lines down, you refer to the jovial tone. You say, but the jovial tone the view that in implementing containment measures and suspending work and schooling, the Italians were overreacting, and the breezy confidence that we would do better than others had jarred with me. And just carrying on, you described raising at this meeting concerns that you'd essentially picked up at the school gate or on your sort of parents' WhatsApps, and saying surely we should just pause for a moment. And Chris Whitty supporting you. But then, to finish off, if we go over the page, you say that after that sort of moment, shortly after, the conversation went back to the assertion that we were so well prepared, we shouldn't panic. And you say you left the room even more concerned that we were in the wrong place tonally, feeling I had been patronised for raising the point, and I was particularly bothered by the supreme confidence I had heard.
I think, yes, and obviously that is accurate. I think that the thing I was most concerned about at the time is I really thought that people wanted to know the right thing to do. I wanted to know the right thing to do. You know, should we be keeping our children off school if they had a cough? Should we be seeing vulnerable people and grandparents? It really wasn't clear, and I happen to have great faith and confidence in that most of the time people will do the right thing. And I felt it was that disconnect that I felt so strongly that actually, if we could just tell people what the right and kind and proper thing to do is, people would do that. And sitting there and saying it was great and sort of laughing at the Italians was it just felt completely, well, it felt how it sounds.
You may have answered in part my next question, because I wanted to ask you whether this was just sort of macho posturing or whether it actually had an effect on policy. And is it the case then, do you think, that this approach you're describing slowed down or even prevented the government from doing perhaps the messaging that it ought to have done?
I think it would be quite hard for me to know, because there is if you are in that sort of meeting with that sort of Prime Minister in that sort of environment, it's quite hard to be the person who injects a note of caution or says, I'm not really sure about this. So I can't say that it wasn't, I can't presume that because that's what I heard, that elsewhere there weren't also people saying, hang on a second. I imagine that there were, actually. It's whether they were heard or not that I think is the question. And I would say undoubtedly that the sort of unbelievably bullish, we're going to be great at everything approach is not a smart mentality to have inside a government meeting.
I want to just look at another part of your witness statement, which relates to something that's going on at the same time. It's the question of your response to the way in which restrictions about football matches were addressed. It's page 29, paragraph 52. So you refer, in fact, to the 2nd of March, so perhaps a day or two before that meeting that we were just discussing. And you say then that you attended both the Prime Minister's morning meeting and also a briefing for opposition frontbench politicians, which, as we'll come to see, was another of your duties, was it not?
Yes.
And you described this was at a time when there was an issue as to whether attendance at football matches should be restricted, and the government's policy was that it wasn't necessary because everyone was outdoors. And you had concerns about this, which was in part prompted by a discussion with opposition politicians.
Yes, that's right. And this is probably it's at this point that alarm bells start really ringing in my mind. And it might be a good point to say it's actually quite important in terms of the operation of government that you don't start interfering with other people's day jobs, particularly when you're senior. So I was quite careful at this period of time to try to understand what was happening rather than to kind of immediately go to marching about, questioning and saying this doesn't feel right to me. So I felt that was the proper thing to do. I wish absolutely I had said more and done more and trusted my instincts much earlier. I don't think there's anybody who's going to sit before you who isn't going to say that about what happened in the February in particularly. But this was a good example of the opposition politicians who, throughout this period, were entirely reasonable in asking questions in private and not criticising the government in public, that it was the Shadow Health Secretary, as I say here, had asked a question about why going to the football was okay, given what he and I knew about going to the football, which, yes, of course, when you're in the stadium shouting into the ground, that probably is low risk of transition. But when you're in the pub or on the train beforehand or in the concourses, you're incredibly close to other people. And I should say I spent a long time at the Premier League, a long time after this, trying to make going to football grounds safe in terms of COVID transition. But I was worried that the fact that the kind of house view was that football games were okay showed, and this is not a criticism of the people, it's a criticism of process and of other things, that nobody who was involved in that discussion had probably ever been to a football game in quite the way that most people go to football games. And it was that gap between what I knew to be how most people live their lives and what was really happening in places, and this theoretical idea that standing outside singing was okay, that made me worry about what other disconnects there might be. It wasn't just about football, it was that this seemed like a big problem if people were thinking that something was one thing when it was really something completely different.
Yeah, and so we've touched on the sort of macho culture, overconfidence, but this is another theme that we'll come back to in your statement, won't we? A concern about lack of real-world experience around the table amongst those who are taking these decisions.
Yeah.
Going back, though, if we may, to that question of overconfidence, one of the points that was made that you've referred to was this idea that there was a plan. Not just a plan, but a very good plan, a world-beating plan. And if we can look, yes, at paragraph 30, thank you, on page 16, you say, you refer to the action plan that was published in March, early March. And you say, in retrospect, this is an extraordinary document, given that so many of the assertions about how well prepared we were would turn out to be wrong only weeks later. But it goes, as you say, in the statement some way to explaining that level of confidence at the time that there were plans in place. Now, we heard Mr Kane yesterday giving his evidence about this plan, saying that when he read it, he thought it was a sort of communications document. It had no substance to it. Did that strike you at the time?
So, of all of the things I had to go back and read, I found rereading this document one of the hardest in retrospect, because it's so far away from what the reality turned out to be. I, like Mr Kane, I thought it was a communications document, and that underneath it there would be things that I would recognise as a plan, as in who's doing what by when, what's the strategy, some enormously laborious bureaucratic documents which I knew and loved at the time, and I thought that's what there was. And it was, of all of the shocking things at that period of time, discovering that there wasn't actually that sort of document.
And if we look at the next paragraph, paragraph 31, we see you do say that at around this time in early March you started asking for the plans, so-called, you've used inverted commas, so that you could dovetail the advice that you would be giving with the plans that you thought were about to be taken out of the drawer and implemented. Did you ever find those plans?
No.
Do you think they existed?
I don't know. They didn't exist in a way that was usable or that anybody had. And I think these are not. There is the Cabinet Office Crisis Response Plan, but there is also that the pandemic readiness was the responsibility of the Department for Health. So the working assumption, incorrect, was that the Department of Health had a whole series of plans that were ready for this, and that there then was a sequential or related series of plans for the Cabinet Office to coordinate. I don't think anybody in the Cabinet Office thought that their beginning, middle and end of their whole job was responding to the pandemic. They were supposed to be coordinating the plans that other people that had existed and were practiced. I don't think I saw a plan for that either, by the way. I'm not saying that both of these things existed, but it's sort of a gap on a gap rather than...
So we're talking about plans that should have been drawn up in different places.
Yes.
But at least part of the problem, perhaps what you really wanted to see were those plans from the Department of Health focusing on this pandemic preparedness set of issues.
Yes, and I don't know if it will be possible to... There might be very good reasons why you can't publish these, but I attached to my witness statement the Eurozone contingency plans that we had in the Cabinet Office, and they go into... There's an operations manual, there's a meetings manual, there's a communications manual. It's basically a lot of groundwork, which even if there had been plans, they wouldn't have been perfect for this time. I think it's important to say that too. But that was the sort of thing that I thought existed, and or something like the plans for no deal exit, which were incredibly thorough and ready to go, in that it was perfectly possible to pick it up and see what meeting happened in what order. And the thing that I thought I was doing was just taking all of that planning and then putting on top of it, this is how we will manage cabinet and collective decision making, and these are the structures and way we should arrange ourselves in the Cabinet Office. I don't think even at this time I really understood that wasn't in fact the question.
There was nothing for you to start with from the Department for Health? No. And you detail in your statement, Ms MacNamara, you say you've gone back and thought why you didn't challenge this earlier, why you had this assumption, which, to be fair, we've heard you shared with many other people, that there were these plans in place. And you give a number of reasons, and I just want to pick up, in fact, on the last one. So if we can go to page 20 of your statement. It's the little Roman 6 at the top. You make the point that the Cabinet was told, in your words, time and time again by the Health Secretary that we had plans in place.
Yeah.
In your hearing?
Yes.
Was there any ambiguity looking back?
No.
Had you assumed that when he said that, he knew what he was talking about?
I assumed he'd seen them and been through them and thought they were adequate. I thought that's what he was saying.
As it turns out, that really couldn't have been the case, could it?
I mean, you'd have to ask him, but I would not understand a scenario where these plans did exist and yet we never got them.
Can I move on and ask you about just one other issue relating to this period, and that's the so-called chickenpox parties. It's page 32 of your statement, paragraph 59. Again, we're still talking about that early March period. And it's been publicly discussed, has it not, this idea that your boss, the Cabinet Secretary, Mark Sedwill, was talking at this stage about chickenpox parties. And Mr Cummings was asked about this yesterday, and his evidence was that he was profoundly shocked when he heard about these discussions, because they seemed to him to indicate quite how far removed from reality, if you like, people's understanding, including Mr Sedwill's, were of the pandemic and how far it had reached. In your statement, first of all, let's be clear, you say that you're not sure that actually Mr Sedwill advocated chickenpox parties, but you think it probably was something that was discussed by him in the Cabinet Office. And as I read it, your take on this is that, if you like, it provides an insight into the way people were thinking about the pandemic as late as early March.
I think it really shows our lack of understanding. I think our collective, and I can't say what basis this was on, but I don't think we understood how serious COVID could be for certain people. I don't think we properly understood any of the serious consequences like long COVID, any of these things. And I think we definitely did have the mindset that the thing to do was to, if you had COVID, then you'd be better, and then it would be better because you weren't going to get COVID again. The notion that we'd be reinfected. Now, that could just be our collective ignorance rather than something that was said. I definitely don't remember Mark Sedwell advocating chickenpox parties. We were talking a lot about family dynamics and what people would do. I mean, and by the way, I think chickenpox parties are a very bad idea. But it's more revealing of what we were thinking at the time and our lack of understanding, I think.
Yeah. Let me move on to a different, although related, subject, and it is this idea of, quotes, following the science. It's paragraph 36 and page 21, if we can. And just picking it up from the start of that paragraph, you say you remember conversations in the same period as we're talking about now, in late January, early February, where those of us working together in number 10 and the Cabinet Office, at one step removed from the handling of the response, expressed doubt about the argument that we should, quotes, follow the science. And you go on to say this is one of those areas where you wish you'd been able to access your phone because you have a memory that you were texting or WhatsApping people about this. Is that right?
Yes.
But as we'll see, it wasn't just texts, because there were some emails that you sent about that, and we'll come to those. But if we move on, if we can, to... could we stay with paragraph 36, please? You make it clear that the concern wasn't that you thought that Chris Whitty and Patrick Vallance, and no doubt all of those who supported them, were anything other than excellent scientists who could provide scientific advice. What you go on to sketch out is a slightly different concern. Perhaps you can explain it.
I thought it was a very odd thing to say. It's not what governments normally do, is just decide that they're going to blindly follow advice from something else. So that's my first question with it, is why are we following, is that the right thing that a government should be doing, is following the science? And I also, probably more significantly, didn't understand what the science was, and thought it felt both like, to my first point, a bit of a cop-out. We're not making any decisions, we're just following the science, and an unfair one on the scientists in particular. And then secondly, there's so much and so many different scientific questions involved, and even I, who's not an expert, could see that. So I thought it was an odd thing to stick so religiously to, although I could see its value as a comms line.
If we look at paragraph 38, which is over on the next page, you make a further point, Ms MacNamara, which as I understand it, is that perhaps because science was something that people were less confident about, people at the centre, than other areas, it was almost like a safety blanket. Because epidemiology, no doubt modelling, is actually really quite complicated science, which decision makers didn't feel confident with. They reached for this idea of following the science in a way that, to use the point you make there, they wouldn't have done in another situation. For example, economics. And you say it would have been laughable to propose following the economics, but nonetheless, people did say they would follow the science.
Yes, and I should say there are a very large number of very brilliant scientists and people with scientific backgrounds working in Whitehall, so it's not that they're not there, it's just that they're rarely in the kind of upper echelons of the civil service in the Cabinet Office, and also in the kind of ministerial and political environment. So that was my point, really, that that sort of ignorance, which I would, Mr Cummings and I are both history graduates, so there's only so much of your own learning and knowledge that you can apply to asking good questions. And I think that we were collectively underconfident on being able to ask questions about science, even though we had some very good scientific advisors around us.
Let me ask you a more direct question about this. We've seen evidence, in particular from Patrick Vallance's diaries, but not only that, that he and others were frustrated about the fact that the Prime Minister, Mr Johnson, didn't understand the science and would get it wrong, and they would have to repeatedly explain what they regarded as being quite basic points about infection rates, modelling, worst case scenarios, and so on. Did you experience that too?
Yes. As in, did I witness that?
Yes.
Yes.
Drawing this together, at paragraph 39, at the bottom of this page and going over to the next, you make the point that science was really only one part of the decisions, that sort of suite of decisions that was going to need to be made. And if we can just skip to the next page and the end of that paragraph, you say the questions about how to respond to COVID were, in my mind, huge political, ethical, moral, social and economic questions that went to the heart of the kind of country we were or wanted to be, alongside a whole set of relentlessly practical operational issues, like the supply of food and medical equipment. There would be hard choices, and they should be made by elected ministers. Is that part of this disagreement that you had with this phrase of following the science?
Yes, I thought it was unfair in two directions. So never mind the point about what science and which scientists and does anybody understand the science, but this was going to be huge for the whole country and for everybody, and it wasn't right to abnegate responsibility to effectively an unelected group of people and put everything on their shoulders, both because it wasn't fair and right for them, but probably more importantly, it's not fair and right in terms of who these choices belong to.
Let's just look at a document where you raised this issue at the time. So it's tab 6 in the bundle, and it's INQ 285980. It's the top of that page. You're emailing Mark Sweeney in early March, and the second paragraph, there's a conversation about something else, and then you say, BTW, by the way, apart from my mini rant about the masculine tone, I have some views about the way we are treating science like it's the word of God. We don't always go where the science leads us. Chris Whitty is exceptional, by the way, so this is not a pop at him, but the answer isn't just what is rational. And there's another email, which I won't bring up, at about the same time, where you make a similar point that this idea of following the science is giving too much weight to scientific advice.
Yeah.
So does this reflect the type of concerns you were expressing at the time?
It does. It does. And Mr O'Connor, would you mind if I made a similar point? I don't know whether later in where my evidence we're going to get to talking about the Grenfell fire, but I can see that that's on the screen.
No, do.
And I just want to... You may see through my evidence that I am referring back to the learning I had from having been the Director General for Housing and Planning at the time of the fire. I just am always conscious that it's not just a policy experience. It was a tragedy that happened in our city, and 72 people lost their lives, and a lot of other people's lives were profoundly changed by that. And I wouldn't want anybody to see what I was saying or hear what I'm saying and not think that I don't acknowledge that as a separate thing. It's not. I think it's just important to make that clear.
Thank you. We see that. Last thing I wanted to ask you about this, though, is that what we see here is you talking to Mark Sweeney, who was another senior civil servant in the Cabinet Office, about following the science. Is this something you took up with Boris Johnson or elected politicians, expressing the type of views you've described today and which you seem to have been emailing Mark Sweeney about?
I don't remember raising it with Mr Johnson, but I did see him regularly and felt very comfortable with being able to say what I thought to him and ask him questions. So it's perfectly possible that I would have said, what does this even mean? What is the science or something? I don't think, I can't remember a specific instance, but it would be very surprising to me to have felt so clearly about something for a number of weeks and not to have said it to him. I would have done.
Yeah. Let's move on in the chronology, Ms MacNamara. I want to ask you about that period in the middle of March. We've certainly heard a lot of evidence yesterday about that time when the strategy changed. As you subsequently discovered, you were in fact coming down with COVID yourself, weren't you?
Yes.
On Friday the 13th and Saturday the 14th of March. And I think it's right that, was it the Saturday that was your last day in the Cabinet Office, and you dialed in to some meetings on the Sunday? And
so
then
I worked from home all day Sunday,
yeah,
but decided not to go to the office because I was worried that I might have the virus by then.
Yeah, so we'll bear that in mind. But with that in mind, let's look at page 32 of your statement, please, and paragraph 60, at the bottom of the page. And you quote there the account which Mr Cummings has given of that occasion towards the end of the day on Friday the 13th of March, where you walk in. I mean, as we'll come to see, perhaps we should have touched on this earlier, we've heard about Downing Street and the Cabinet Office being, as it were, places very close to each other, but with separate organisations. You were based in the Cabinet Office, were you not? But spent much of your time in Downing Street.
Yes.
And the account that Mr Cummings has given is of you walking from the Cabinet Office into Downing Street and, in fact, into the Prime Minister's study that evening. He wasn't there, the Prime Minister. But you saying, and this is his account, but I think you agree with it, that you had just been talking to Mark Sweeney, whose name we've just seen, who was in charge of coordinating with the Department for Health. He said, that's Mr Sweeney had said, but you're reporting it, I've been told for years there's a whole plan for this. There is no plan. We're in huge trouble. And then you said, expressed your view that I have come through here to the Prime Minister's office to tell you all I think we're absolutely fucked. I think this country is heading for a disaster. I think we're going to kill thousands of people. As soon as I've been told this, I've come through to see you. It seems from the conversation you're having that that is correct. Give or take a few words, is it right that that's an accurate account?
Yes.
It's very striking.
Yes.
No doubt you can still remember that moment of realisation.
Yes, it was horrible. So I think, you heard from Mr Cummings yesterday. I think that, in effect, on either side of the link door, which is the door between Downing Street and the Cabinet Office, and my office was just above it, that we'd been sort of going through the same process, I think, in those previous 2 weeks, in the sense that there's just increasing concern that actually we were really radically in the wrong place. And my experience that Friday, where I had started with the morning meeting in Downing Street, I think, and then I'd done another briefing with the opposition, where their concerns, all the opposition parties and their concerns were entirely valid, and their anxieties were so clear and high. And I felt, listening to what the government side and my side of the table was saying, I was more alarmed rather than reassured at the end of that meeting. And so I'd spent most of the day that Friday, on top of all of the other things that we'd been doing the previous week, really trying to gauge how much of a problem I thought we had. And it was a sense of foreboding, like I hope nobody sitting in that office ever has that again, actually. It was a very, very scary experience. But I felt that it wasn't in any doubt in my mind at that point that we were heading for a total disaster, and what we had to do was do everything in our power to make it as impact as little as possible in the time we had available, in the circumstances that we were. Not what would have been better weeks or weeks ago, but from that moment on, what were we going to collectively do?
And the context then is the government has a strategy. It's in the action plan. It's contain, delay, mitigate, squashing the sombrero. And as we read this account, what was the real tipping point for you was suddenly realising the complete lack of any supporting planning to make that policy work. Is that right?
It's more that the scale of what was going to have to happen, I think, was just so outside of what anybody had thought might be necessary. So you'll have people before you who are much more familiar with the planning as it was, but that the fact that we would have to effectively ask everybody in the country to stay at home, and the impact that would have. It's one of the things, if you work in government, you can just start to imagine all of the consequentials that will be for what are you going to do about the prison service, what are you going to do about all of the other bits of public service, what about people who are vulnerable. You can just imagine, and I remember feeling this kind of explosion of all of the questions that we would need to be able to answer, and my fear that we wouldn't be able to answer them, and so we'd be trying to deal with these two things. We've got accustomed to talking about lockdowns, and we all lived through it. But if you go back to what it felt like at that time in March, it's sort of inconceivable that you would in fact do what we then went on to do. And I've heard a little bit about, should we have locked down earlier? We could not have gone any faster in a safe way, I don't believe, from that day. Now, could all sorts of other things been different beforehand? I'm pretty sure, yes, of course. But the scale of the undertaking was absolutely enormous. And I think it's, once we got used to sort of imagining you could lock down and open up and lock down and open up, there was nothing like that. There wasn't a manual or a playbook or anything.
I just want to explore this issue. You said there that part of your thinking on this day was there was going to be a need to lock down, and how was that going to happen? As I said, the plan at the time was that there wasn't going to be a lockdown. There was going to be squashing the sombrero. And what we've heard from Mr Cummings and others is that what made them realise at very much this time that there would need to be a change was that the plan, the mitigation plan, wouldn't work because the NHS would be overwhelmed, and it simply couldn't be done because it would involve too many people dying.
Yeah.
That's not quite what you've put here, and I'm just interested whether that was something that was in your mind, or whether it was more, as you've said, to do with the scale of the planning that was going to be needed.
I think that is a fair distinction, actually, and definitely the conversation that I then went on to have with Mr Cummings and Mr Glassborough and Mr Warner in number 10, I understood from that conversation much more that there wasn't going to be this peak that we were going to get through or squash. There was going to be a long and sustained period of time. But I think at that time, I didn't feel I had a very good understanding of what the virus would be. I didn't have a very good understanding of the impact on NHS capacity. What I had a good instinct for was seeing what was happening elsewhere in the world, and knowing, having had a number of conversations with Mr Sweeney about the legislation that might be needed, that the worst case scenario, which worryingly was looking like something that might actually happen, not a worst case scenario, we just hadn't done any of the plannings. How are people going to get fed if they have to stay at home? what's going to happen to schools if people have to stay at home. And it was those more, which you might expect. My background is as a domestic policy civil servant, so that's probably where my mind went more than anything else. And I probably still, at that point, fervently hoped that the planning we would have to do for that extreme scenario wasn't in fact going to be needed. But I really knew we had to get that extreme scenario actually worked up.
We've heard you describe in your statement as well the series of meetings which then took place over that weekend, and we'll have other witnesses who can help us with those, so I'm not going to take you through them in detail, but I do want to ask you just about one of the meetings which you describe at paragraph 65 of your witness statement, so it's on page 35. And I think it would have been on the Saturday, where you say that I think it was in preparation for a larger meeting involving more senior decision makers. There was what you describe as a scratchy meeting with the DHSC and others that Mark Sweeney chaired, where, your words, you say it was clear that the DHSC view was to wait until the latest possible moment to tell people they had to stay at home. So what are you trying to convey by that word scratchy and the content of that meeting?
So I think when we were, and you're right, there were lots and lots of meeting notes and papers and details of all of the meetings that happened on that Saturday. When we were trying to find the note of this meeting, I think we worked out that it was actually on the Sunday. So it was the Sunday meeting of for the Prime Minister, and this was the prep meeting before then to make sure, it's a classic bit of civil servicing, to make sure that the civil servants all understand what the other civil servants are going to say, and that you've got some sort of coordination, so you're using the ministerial time most effectively. The reason I remember this as scratchy is because at this point it felt like we really were in slightly different places in terms of a group of us in the centre who had got much further on how bad this must be quite quickly, and a perfectly reasonable, I should say, concern from DHSC, who knew as well, if not better than we did, that the planning wasn't there to support this, that there needed to be more time to get some of this planning actually done. So it's a bit of the scratchiness was precisely that. Yep. At this point, I think we were in an unbelievably urgent hurry to get to where we needed to be as fast as possible.
And one of the points that Mr Cummings made in his evidence yesterday is that we shouldn't assume that there was some sort of transition from the containment plan to the suppression plan that everyone agreed with, and that it was seamless. In fact, over this weekend, people were disagreeing. There was uncertainty. It was by no means a smooth transition from Plan A to Plan B, and it sounds like you agree with that.
I do agree with that, and it's because I think we'd got to a different place much faster, and it's not. That is also reasonable if you think about it from the perspective of the DHSC colleagues involved. They were more well-versed, might well have understood better the consequences for the health operation. It's not. I wouldn't want to give the impression that they didn't have some valid points that they were making. I just think we'd moved into a different way of thinking about what might happen.
Yeah. Just lastly on this then, a couple of fairly high-level questions. Mr Kane yesterday gave evidence that although, to be clear, no decision to lock down was made over that weekend, and I think that's a commonly agreed evidence, his impression was that over that weekend it became the collective view, no doubt Mr Cummings' point that not smoothly, but still it became the collective view that there would need to be a lockdown. Do you agree with that?
That's certainly how I saw it, yes.
As we've heard, you dropped out of the picture because you became unwell. But of course we know that the lockdown was announced about 10 days later on the Monday of the week after. were you expecting the lockdown to happen earlier than that? I mean, you've given us a clue to your answer already in terms of how much needed to be done, but your own view, had you expected it to happen earlier or not?
I don't know is the honest answer. I thought it would happen as soon as it was possible to do it, because given there were some really big questions to ask and answer, I think.
And we've heard that a lot went on the following week involving Mr Johnson and others, but you were not involved in any of that because you, in fact, your whole family got COVID.
Yep.
You were off work from that Monday for, I think, the best part of 3 weeks.
Yes, I don't think, the other thing I should say, and this might help you with the evidence in the emails and the record, I'm not sure we referred to it as lockdown at that point. I don't think we were talking about there being a lockdown. I think we were talking about people having to stay at home from memory.
Moving on then, looking ahead, you came back to work on April the 2nd, which, as I say, I think was about 2.5 weeks or so that you were off. Mm-hmm. And then, as we've heard, you were in post until February of 2021 when you left the Cabinet Office. During that time then, the Prime Minister was very unwell and there were issues for you to deal with in that regard. Your boss, Mark Sedwill, resigned and was replaced by Simon Case. Mm-hmm. You had serious concerns about conditions, working conditions at the Cabinet Office, and there were steps you took to try and address that problem. And there was an involvement on your part in a number of other COVID-related matters. So would it be fair to say it was a very busy, very demanding time for you following your return to work?
Yes, undoubtedly. And
if we can look, please, at paragraph 73 of your witness statement, so it's page 40. You give perhaps if we can just briefly zoom out so we can see the whole page. The title is Prisons, mm-hmm. But you give us a vignette, if you like, of an incident that took place on your first day back, which will look, but I think you're suggesting that it in fact drew together some of the themes of your experience that was to come. What in fact happened, you say, was that a relatively junior member of the staff at Number 10 came to you with a concern about what was going to happen at prisons, and in particular, whether prisoners who were in unsafe conditions in prisons should be released or not. And without reading out the paragraphs, the essence of it is that you were surprised and concerned that a decision hadn't been taken at departmental level, mm-hmm. And there seemed to be a certain amount of failure to take a decision that needed to be taken. Is that right?
Yes. I was worried, well, as I said in the statement, worried that the decision should probably have been taken in the department, and then if that wasn't going to be the case, it should have been taken in the Cabinet Committee structures that had been set up. So the notion this decision was still hanging and was dependent on the Prime Minister personally taking a view was a cause for concern for me.
And that it had needed to be raised with you by a junior member of staff. That's not the way the government should have been running.
No, and I should say, although she was, technically in civil service terms, junior, rather brilliant, and the private secretary responsible for Home Affairs, so she was effectively doing her job, but the fact that it was a private secretary in Number 10 who was having to force such a big question is not how government should operate, no.
I should have made that clear. She was junior to you,
yes.
but that includes rather a lot of people in the civil service.
Yeah.
But then let's just look at paragraph 74 if we can, because you say, in retrospect, many of the systemic problems that caused substantial issues in managing the response were visible in this moment. First of all, the sucking into Number 10 of too much of the decision-making by the political machine, and this compounding a narrowed perspective. Secondly, a general lack of knowledge or understanding of how large parts of the state operate. Thirdly, an over-ideological, in your view, approach to individual decisions, an absence of the accountable people in departments being involved or sufficiently involving themselves in decision making, cabinet government not serving its usual purpose, unreasonable pressure on the number 10 private office, and finally, an absence of humanity. We will go to most, if not all, of those themes in the questions I'm going to ask you after a break that we may have shortly. But I wanted just to pick up on that very last consideration. You say an absence of humanity. It's a broad term. It's a powerful term. What did you mean by it?
I'm sure, as you say, we'll talk more about this in general, but I think in this particular example, it was the fact that there would be individual prison officers at risk, your public servants who were just, coming to work and doing their job, that individual prisoners who had already, in effect, been punished for the crime that they had committed by being in prison, the lack of care or comprehension that they then needed also to be looked after. There was a responsibility to look after those people. And then also that there was a responsibility to look after the families of the people for whom the prisoners might be returning back to. And it just felt very, very cold, actually, in terms of the decision making. But all of those broader points are true as well. I included this as an illustration. I'm sure there are countless more.
Yeah. Well, as I say, we will go on and touch on, as I say, I think most, if not all, of those themes. Maybe since I'm going to move on, may this be a good moment for a break?
Certainly. I shall return at 11:25. All rise. Mr O'Connor.
Ms MacNamara, we had reached the moment where you returned to work following your period of illness with COVID. I think we said that your return day was the 2nd of April. And one of the issues that you had to address as soon as you got back was the question of the Prime Minister's illness and how the Cabinet Office was going to respond to that. I think it was a Thursday, that 2nd of April, and at that point, I think it's right that the Prime Minister was already ill and self-isolating in his flat in Downing Street, and he was admitted to hospital over that next weekend, and as we all know, became very ill. And you describe in your witness statement one of the tasks then that you had to address was thinking through how, as a matter of constitutional propriety, the government would continue whilst he was unwell, in particular in the event that he became too ill to communicate his wishes, which, as we know, he did. So you describe in your witness statement discussions that took place, decisions being made, and you refer to Dominic Raab as the first Secretary of State, assuming certain responsibilities. And it's apparent, if we can, we don't need to turn it up, but at paragraph 94 of your statement, you refer to, in your words, having to make it up as you go along. And just, I'm going to take you to a document in a moment, but the sense of your statement is that there were no plans, a bit like we were talking before the break, there were no plans for you to reach for to show you and your colleagues how you might address this problem. Is that right?
Yes, it is. And I think it's probably accurate to say that there were times of this period where it felt like working or living in a sort of dystopian nightmare, that just when one terrible thing had happened, then the next terrible thing was about to happen. And the Prime Minister being so gravely ill was obviously awful. It is fair to say that there's no magic cupboard you can open in the Cabinet Office that has a kind of, this is what you should do in these circumstances. But I wouldn't want to be too alarming around that, because there is also always precedent and practice and knowledge and expertise that you can draw on in those circumstances. But personally, it was very challenging. The Cabinet Secretary also had COVID at this point in time, and we felt very vulnerable, if I'm honest.
And we can get a sense of the thought processes and the work you were doing if we look at a document which is tab 13 in the bundle. It's 286029. And this is a document, Ms MacNamara, you drafted, didn't you?
Yes.
And I think we underline the word draft, don't we?
Yes. I mean, this is one of the experiences of coming before these inquiries, is that you see your very, very first. This is the first draft of my thinking on that Sunday, I think, on the Sunday.
But we take it as we find it, Ms MacNamara, but it's certainly a valuable insight into the types of issues that you felt you needed to consider at the time. And we can see you've put, well, the title, How We Manage While the PM is Ill, and scenario A being if he's ill but able to communicate, and B, if he's unable to communicate his wishes. And then we see, do we not, a series of, if you like, categories of decision-making, which perhaps reflected Cabinet Office directorates or areas of work, and a sort of first thought as to how you might manage who would take these decisions, whether they needed to be taken, whether they could be deferred. It's a battle plan, really, is it not?
It's the very first draft of it, and I think you have not that I could promise the later draft is much more polished, but you have got a more final version which lines up some of this, yes.
We see that then, if we go on to the second page, there's a series in true good civil service style of lines to take, questions and answers, the types of issues that you're obviously anticipating people, perhaps not necessarily the press, but people with whom you're dealing will want to know the answer. And we get a sense, perhaps, of that vulnerability you were just describing, and exactly how anxious and also the sense of making it up as you go along. If we look at the third page, the question, what if the PM gets worse? So perhaps scenario C, and your fairly frank reflection, God knows what we say here, but final sentence, you don't think there's a world in which that level of uncertainty will stretch out in a way that is constitutionally, I think you meant sustainable, in other words.
Yeah.
If he does worsen, we'll have to make a plan. Is that really what you're saying?
Yes, and this is a conversational style because it's a document I think that I had written for then various teams to start fleshing out and writing the real kind of much more detailed Q&A. But this is entirely, it's entirely in line with obviously what I was thinking that day.
Yeah, I just want to come back to that question of preparedness. We've been told many times that a pandemic, an influenza pandemic, in fact, was at the top of the national risk register. We've spoken about the plans that were or weren't made to prepare for such a pandemic. But even if it was a flu pandemic that was to emerge rather than the COVID pandemic that we know in fact took place, even in that situation, it would be entirely foreseeable, would it not, that people at the top of government, including the Prime Minister, would be affected by the illness. Don't you think, with that in mind, that this is the sort of thinking that should have been done in advance, not necessarily by you, but by the system?
So I do think there should have been more thinking in advance, and I hope that there is now. I'd be amazed and horrified if there isn't, about when you are in this particular kind of crisis where the key people can get ill or their families get ill or they suffer a bereavement, that there is a better set of plans and provisions, yes, for the Prime Minister, but also other ministers. And although you're absolutely right, there isn't a kind of open the box and here is the plan. On a Prime Minister being ill, fortunately, Mark Sedwill and I had in fact done some work and thinking about this in the summer of 2018, it must have been, just after we'd both taken up our role. And I should also point out there are obviously people whose job it is to think about these things in the Cabinet Office. So I was surrounded by people with deep constitutional expertise. But the nature of our constitution is that not everything is, very little is written down. Yeah. And in practice, what it relies on is sensible people making sensible decisions. I don't think anybody had foreseen the difficulties of trying to do this particular bit of thinking while actually the impact of the Prime Minister being so ill, or God forbid the worst happened, would also be even more significant a thing for the country, and the combined potential for that sort of instability was genuinely awful.
Of course, no doubt you're right to say that there are people in the Cabinet Office who are steeped in these sorts of issues, but I think you're also agreeing that it's very sensible to have some plans prepared.
Yes, and it will not surprise you to know that after this we made sure that there were plans, and I was pleased to see in the Cabinet Secretary's statement that there are in fact now there's more robust arrangements in place. It's again not an experience you would want anybody to go through twice.
And just taking a step to one side, we've talked about the planning that was there or wasn't there for how to deal with this situation of the Prime Minister becoming very ill. But as you've mentioned, it's also the case that particularly at this time, sort of March, early April, there were an awful lot of people at the top of government who were ill.
Yeah.
not just the Prime Minister. You've also mentioned Mr Sedwill, who was ill. You were ill. Matt Hancock had COVID. So a whole group of you who were all at the core of decision-making, who all became unwell. And, of course, we don't know exactly how any of you caught COVID. But is it fair to say that there weren't the plans that there might have been, or the procedures or the safeguards that there might have been to stop quite so many people in and around Downing Street getting a transmissible virus at a time of a pandemic?
It's absolutely fair, and as I say, I really hope that there is more of a plan now, and it's probably the case that even weeks and weeks before there was a decision to be made to, go to the next stage in terms of the whole country, there should have been more care taken about the key people who might be involved in those decisions, and some of the things that then were put in place later in terms of having alternates and people not always being in the same room and all that sensible stuff about how would you minimise transmission. I would hope that that's there now.
I mean, no doubt you're right that there are some quite sophisticated plans that could be made. As soon as you know the virus is coming, let's think about separating people, let's think about taking extra precautions, all those clever things that you could put in place to try and minimise the risk that a number of people in a particular part of government will all be off at the same time.
Yeah.
But you refer in your statement to something far more basic. If we can look at page 95 of your statement, please. It's paragraph 194. So 4 or 5 lines down in that, well, let's start perhaps at the beginning. You say, as an organisation, the Cabinet Office excels in creating the kind of faceless bureaucracy that is maddening, even to those who are theoretically in positions of power. From the outset, there was a failure to recognise that there was a duty of care for the people who worked in Number 10, or the Secretariat, or the Task Force. And then this, even the basics were neglected. As a small but demonstrative example, it took 7 months after the beginning of the pandemic to get a hand sanitizer station by the link door between Number 10 and the Cabinet Office, a door with a pin pad that anyone who worked for the Prime Minister was constantly having to touch on their way through. Yeah. 7 months, Ms MacNamara.
Even I was surprised by that when I went back into the record and saw how long it actually took.
It's all very well to think of those complicated arrangements, a bit like the royal family, to stop senior officials and politicians becoming infected. But if they're working between the Cabinet Office and Number 10, and they're all having to touch a touchpad, and there's no hand sanitizer, it's perhaps hardly surprising that so many of you got COVID at the same time.
It's not surprising at all, and also it's indicative of just a lack of care, actually, which I think was damaging in all sorts of ways.
Do you think that sort of planning has now been done, or systems have been changed so that we could have some confidence that if there was, let's say, a flu pandemic, just as transmissible, if not more so, than COVID, perhaps there'll be some sanitizer on that touchpad?
I hope so, and I hope that people are better looked after, more importantly.
I want to move on to another topic, but another matter which concerned you as soon as you came back to work. And that was, you describe in your statement that as soon as you came back, really, you quickly realised that there were very serious problems with the Cabinet Office team, in part because they told you, members of staff that is, that they were working under great pressure and they were unhappy.
Yes.
And you described that at least one of the responses to that problem was conducting a review, as we'll see. And that was something that you did, I think, in early May of that year, 2020. We'll look at the documents in a minute, but we'll see, I think, that you worked, first of all, on this with Martin Reynolds, the Principal Private Secretary for the Prime Minister. He is, of course, someone we're familiar with. He gave evidence earlier this week. also an official called John Owen, who we haven't seen so much of. Can you tell us what his job was, please?
So John Owen was the Principal Private Secretary to the Cabinet Secretary. So he was a director working in the Cabinet Office. So
he was he did a similar job to Mr Reynolds.
He did the job, yeah, before the Cabinet. So the Cabinet Secretary has their own private office, and John Owen was the director of that during that time.
And perhaps that leads into the next point, which is that we've touched on the fact that Number 10 and the Cabinet Office are, as it were, different but the same. But this was a piece of work that you did across both organisations.
So I felt it was very important that it was owned by both organisations because of some of the friction, actually, and that also it was much better if it was the Prime Minister and the Cabinet Secretary had together asked for this piece of work. And the reason why I thought it was important to sort of provide a space where all the people who were very cross and unhappy could tell me exactly how cross and unhappy they were in a way that I could actually do something about it. I think at this time, probably in line with throughout, what I was trying to do was do the things that I could. And one of the things I felt very strongly was that, you can march about saying everything is terrible, you can commentate on the chaos, or that you can try to do something to fix things. And this is one of my attempts to try to do something to fix things. And it was partly giving space for people to be upset and unhappy, as well as then trying to get them to tell me how to fix it.
And they told you in person, in the sense you describe in your statement, interviewing, I think, 40 or more people over the course of a few days for the purposes of the report.
Yes.
Were those interviews you conducted on your own or with Mr Owen?
I think Martin and I did most of them together. There may have been a couple of ones in Number 10 that he did and a couple of ones similarly in the Cabinet Office, and that was just in the interests of time. But Mr Reynolds was also really concerned about what he could see about how people were feeling, so it was something we did together.
Now let's look first of all at the report itself, if we may. So that's at tab 22, and thank you, it's on the screen. I'm not going to go in any detail to this document, Ms MacNamara, because as we know it went through various drafts, didn't it? And I think you actually say in your statement that this final draft, this document we're looking at, your words, may have been too kind. Following that train of thought, there's some other stuff in the drafts which I want to ask you about. But just looking at this, we see the date, May 2020, and your name and Mr Reynolds' name. We don't actually, it doesn't say who it's addressed to, but do we take it from your earlier answer that it would have been addressed, to the Prime Minister and Cabinet Secretary?
Cabinet Secretary, to both of them.
So they would have both had a copy of this?
Yeah. Well, sorry. They were both given a copy of it, as far as I understand. Right. The Cabinet Secretary certainly had it.
Yeah. Well, we'll look back at it, but let me follow on from there. Did you discuss the contents of this document with either the Cabinet Secretary or the Prime Minister, or both?
I discussed it with the Cabinet Secretary, yes.
But not with the Prime Minister?
No, and I think Martin was going to discuss it with we were both working for our principals, if you like, so there's nothing particularly to read into that.
No.
I probably, in any case, would have had a much more detailed, conversation with Mark Sedwell, because it was more about the operational management and how we were setting things up. So the Prime Minister's often the customer of the answer, not the creator of the solution. And for Mark Sedwell, would have been much more interested in actually, we would have talked through, in fact, I remember us talking through both what I had heard and then what we were going to do about it as a shared problem.
All right. Well, let's look, if we may, at a draft of this document, which is at tab 29, and it's 136755. I should make it clear, they are very broadly the same, are they not? There are just one or two extra lines in some of these drafts, which I may ask you about, but people shouldn't get the idea that there are huge differences between the versions. And I want to focus on the paragraph 2 of this document, headed "The culture isn't getting the best from people." this is actually a document the inquiry have seen before, Ms MacNamara, but nonetheless, what is included in this paragraph is striking. Your conclusions were that the organisation wasn't working as one team between the Cabinet Office and Number 10. Looking a couple of lines down, not sustainable, people are exhausted and stressed, don't feel confident or empowered to take decisions, a universal sense of powerlessness, trying to do too much so nothing is done well, views ignored, bad behaviours from senior leaders tolerated, too many people behaving as if they've been parachuted in to save the day. A couple of further lines down, lots of people mentioned junior women being talked over or ignored. And then there's a footnote saying that some of the people who made that observation were themselves people who had been talking over junior women. I think it's the footnote that didn't make it into the final
Did that
report.
not make it into the final draft?
And then also this term, we need a modern culture of organised collaboration, not a superhero bun fight. Very similar point was put to Lord O'Donnell. In the context of this crisis, which was now well underway, and the degree of centrality that the Cabinet Office and the Number 10 had in trying to address that crisis, to read these conclusions about the state of morale and ways of working within the Cabinet Office is pretty devastating, isn't it?
Well, I think it was pretty devastating. It's accurate. I also think that it's important to recognise that the fact that there wasn't a plan and there wasn't a system, and that therefore everybody was working to try to run to catch up with themselves, and also extremely worried and anxious about what was happening, feeling all of these different kinds of responsibility. It would sort of be amazing, given that prior of there was not a plan, that if it was, in fact, this perfectly well-ordered and organised experience. I think the other thing I'd like, it's not everybody was behaving badly. So it's it was important to highlight the things that were going wrong and the fact that there were some big cultural issues. But there were also loads of people who weren't doing that. So particularly my criticism of a macho environment doesn't mean that, or men talking over women, doesn't mean that was all the men there all the time. And human beings are messy and complicated, and this was an extraordinarily pressured and difficult situation, and people were working outside of their structures, outside of their competence. They were frightened. And it's not surprising at all to me that didn't bring out the best in some people. I think that the important thing is, like, how do you make sure that when anybody is in those sorts of situations again, there are structures and systems that mitigate against what will happen to human beings in that situation? And I think that's what we were missing.
Yeah, and what you were trying to address as a starting point with this report.
Imperfectly, but yes.
The term superhero bun fight, I think, is another one that didn't make it into the final report.
Yeah.
Help us, is what you were trying to capture. I think it's actually maybe Martin Reynolds who came up with that phrase.
It's John Owen.
Was it John
actually.
Owen? But
yeah.
Was this issue, and you've helpfully made it clear you're not talking about everyone, but clearly there was a problem. Is this a similar issue to that macho overconfidence that you were describing in January, February, or not?
That's a good question. So I'm sure that you don't take the culture to the extremes from nowhere, I imagine. So I think that macho, confident, bravado sort of way of operating undoubtedly made it possible to go from what might be okay in that scenario into something that was really not. Whereas if I think about working for Mrs May, I don't think there's any world in which we could have got from January to May and had this sort of culture, because it just wasn't there in the DNA of the organisation at that time. So I do think it is related, and unfortunately, really, given this, but I probably, out of kindness to John Owen, didn't include his phrase in the final report because we were trying to also be moderate. But I think it's a good indication of the strength of feeling and how alien some of this practice was, particularly for us as civil servants, that you don't normally behave in these ways, and definitely in the domestic bit of the civil service, this is quite an unusual set of, well, culture to work in.
There's a passage in your statement where you talk about, no doubt generalising, but talk about two different sorts of civil servants, one being sort of high ego, I think are the words you use, people, and on the other hand, invisible people, and that the system working best if there's a balance of those two types. But the conclusion perhaps was that the balance had got out of balance during this period.
It had got, but also I think the parachuted in to save the day thing was a real problem. There were lots of new people. They all rightly felt a sense of mission and purpose and wanted to help, and that's a great thing when things are broken, people who run towards broken things. But it does also, if you get 15 people who all think individually they are going to save the day, that does not a happy organisational culture make.
Yeah. Well, let's move on and talk about another of the issues which you identify, which is the question of junior women being talked over or ignored. And you describe in your statement noticing a marked change on your return in this respect. Perhaps we can just go back to your statement. It's on, and let's look at page 50, paragraph 99. And at the beginning of that paragraph, you say, from when I, so page 50, from when I got back to the office, other women who worked in either number 10 or the Cabinet Office sought me out to say how pleased they were to see a woman at the table again. And you go on to say that you were surprised by that because although the Cabinet Office in number 10 historically hadn't been, as it were, perfect in these terms, the issue between men and women hadn't been a matter of comment before, but it was now. You say, pre-COVID, I would not have characterised number 10 or the Cabinet Office as a particularly abnormally sexist environment in the context of Whitehall and Westminster, which are, you say, endemically sexist. But, perhaps this is the point, what started as a murmur became a roar over the next couple of weeks. Not only were there numerous examples of women being ignored, excluded, not listened to or talked over, it was also clear that the female perspective was being missed in advice and decision-making. And we won't go to it, but in another part of your statement, you say women who had worked in number 10 and the Cabinet Office for some time reported feeling as if they'd become invisible overnight. So can you just help us explain what seems to have been a very marked change?
So it was striking, and I think the 2 points are related but different. And I don't know if it was a consequence of the psychological pressure people were under, or I don't know what it was, but it was really, really obvious that not only were there hardly any women there, that when they were there, they were, they had to turn their screens off, or on the Zoom meeting, or they were sitting in the back row, or there just weren't any women talking, which was unusual, and that probably, well, I don't know if it's worse than that, but related to that, women whose job it was to do something were not able to do their jobs properly because they weren't having the space or being asked the right questions or being treated with the respect that they would do. And it was genuinely, it was both striking and awful. And then the fact that there were no women contributing to the policy discussions, problem in itself because there were some expert women who weren't being listened to, and also women were being looked over. Yeah,
and just last reference on this point, but if we can look at page 52, paragraph 102, please. You describe a little bit more of the experience. You say, women working in number 10 in the Cabinet Office experiencing very obvious sexist treatment. You say it was impacting on their work. You say the dominant culture was macho and heroic. Neither are the preserve of men. Women can be macho and heroic too, but the culture was problematic because it meant debate and discussion was limited. Junior people were talked over. It felt that everything was contaminated by ego. It was positively unhelpful when the country needed thoughtful and reflective decision-making. So that does sound that you say, again, that word macho again, it's at least a close relation of the environment, the atmosphere that you were describing from February and March.
Yes.
And we can see that you expressed your concerns about it at the time, and indeed they were shared by others. If we can look, please, at tab 17, 286044. If we can look towards the bottom of that page, this is an email, Ms MacNamara, that you sent. I don't think we have a copy list, but the sense is that it was to a group of women in the Cabinet Office in number 10. It's dated the 13th of April, so a week or so after you got back. And is it right? I'm not going to read through the whole email, but you are drawing attention to some of the very themes that we've just been discussing. Is that right?
Yes, and the reason I sent this email, and I did I'm sure it's possible to find it, who I blind copied it to, was partly me just checking that what I was understanding was right. So that's really why I was doing this, because it was worrying me so much what I'd heard, and I wanted to make sure that I was right, that this was a big problem, not an individual one.
And if we just briefly look over the page, please, later in this email, we can see the first full paragraph on that page. You say, my concern is at the moment the working environment culture is too macho and egotistical, those words that we saw in your statement. It's not going to get the best outcomes. And in the paragraph above, you make the sort of causative point that there are areas of policy that are suffering. You refer there to domestic abuse and abortion. I'm going to come back to some of those issues in a little while, but perhaps it's important to make it clear now. You weren't just... It would have been important anyway to make the point that the treatment was bad, but you felt there were real consequences of that treatment at the time.
Yes, in my hierarchy of concerns, the thing I cared the very most about was whether we were putting our best effort into trying to tackle what the country was faced with. And I felt that this particular set of attitudes and behaviours was getting in the way of that, as well as finding it personally not right.
And if we can look back at the first page of this document, please. I think we will see that other people replied. I mean, well, let me ask you, did you get many responses to this email?
I think everybody replied, yeah.
And what was the tone of the responses?
That they were glad that I'd raised it, and they gave me other good and useful examples and said that they would do what they could to help, broadly speaking.
And thinking of the chronology, this is mid-April, so this would have been one of the steps that led to the review.
Yes, although I don't think I would have seen it like that at the time. I just wanted to fix this particular problem that I could see in front of me.
But on this document, we can see that one of the people who responded was Catherine Hammond, a very senior civil servant in the Cabinet Contingencies Secretariat. And she said, sadly, I 100% agree, this is an issue. And she makes some proposals there.
Yeah.
Just moving on, I wanted to ask you about what, apart from seeking people's views, and we've also mentioned the review that you conducted, what further steps were taken to address this problem? You refer in your statement to the fact that just raising the issue helped, but perhaps didn't change the fundamentals. Did this problem go away or not?
So no, but raising it as an issue and talking about it collectively, I think, helped people to feel clearer about the fact that it was okay for them individually to raise a concern. And after sending this email and a number of conversations, I then spoke to quite a lot of people individually whose behaviour had been highlighted about what had been said, and a lot of those people then moderated their behaviour. I mean, I think in that footnote that didn't make it to the final report, that there is sometimes a gap between these men they were very serious that they were worried about the sexism, and yet they were also sometimes the people who had done the talk. That's also sort of a consequence of working under pressure sometimes. But once the issue was highlighted, lots of people changed, but didn't change the overall, no.
A perhaps related issue is the availability of counselling for staff. And if we can look, please, at this is a document at tab 43, INQ 308-323. Yes. We've moved forward in the chronology a little bit. We're now in mid-June. But this is an email you sent to someone called Carol Bernard. First of all, we note that you were there, again, drawing on your experience from the Grenfell fire and no doubt the support you gave to your staff in the aftermath. But we can see what you've said. You talk about people breaking down in tears and trying to obtain some counselling for them. Was that successful?
No.
Why not?
I'm not sure I can answer that question. It's a profound cause of regret to me that we weren't able to better support people. And I should just be really clear, I'm not in any way the hierarchy of people who had more miserable times and awful things happen in their lives, and the people who had to deal with people dying from COVID were obviously dealing with something much, much worse and more profound. And what I am talking about here is that it is very difficult being in central government in any case in these sorts of situations, never mind when you add all the externalities that these people were dealing with. And I do think it's a gap not to have psychological support available. And I had been able to provide that in other departments I'd worked in pretty easily at very low cost to the taxpayer in a way that was genuinely helpful for all the people working on those things. And I don't really understand why we couldn't do that then.
I don't want to get into the detail of this, Ms MacNamara, but we see one email here where you are trying to obtain some counselling. Did you leave it at that, or did you press for it?
No, I'd asked a number of times in a number of different ways.
Just moving on a little bit, but sticking with these issues that were thrown up on your return and the review that you undertook. One way of describing what was shown, although I'm not sure these exact words are in your review, would be that there was a toxic culture in Downing Street in the Cabinet Office at the time. And the inquiry has heard evidence, in fact heard evidence yesterday, of the repeated use of extremely crude language in, for example, WhatsApps sent between members of the Downing Street team. Was that, do you think, one aspect, or perhaps a product, of that type of toxic culture that you are reporting on in your review?
It was definitely a toxic culture.
The inquiry saw yesterday some particularly crude WhatsApp exchanges between Dominic Cummings and Boris Johnson about you and about your possible departure from the Cabinet Office. Let me ask you, was Dominic Cummings part of that toxic culture, part of the problem?
If you don't, it would be helpful to me to make a couple of comments about those messages. The first is I think it's important to understand what was actually happening at the time. So it is undoubtedly true that the Prime Minister had offered me any number of permanent secretary jobs in order to leave the Cabinet Office during that period of time. And I had repeatedly explained that I wasn't going to participate in another of my colleagues being moved on in order to create a job for me. And so we had been having this exchange for a period of time. The things that Mr Cummings, having seen those messages, it was, it's horrible to read, but it is both surprising and not surprising to me, and I don't know which is worse, actually. I think that he was frustrated with me at the time. I would absolutely own that. I would also say all I was doing was actually working in the service of the then Prime Minister and defending his interests. I'm sure lots of this is not for you, but the two things in particular that he was cross about, one was the appointment of David Frost as the National Security Advisor, where the proposal was that Mr Frost, who had left the civil service as a director, and then taken on very significant political roles, that he be then reappointed into the civil service as a permanent secretary and put in charge of national security. And for reasons I don't probably have to go into, I thought that was wrong, so I wouldn't let that happen, and had in fact come up with a proposal that would fulfil what the Prime Minister wanted, which is that Mr Frost should join the Lords and be a minister, because I felt that was more proper and have accountability. Mr Cummings in those messages is also frustrated with me and says that I was sacking special advisors, which I never did, would never be my role. The particular thing that he looks to be extremely cross about in the August is because we were involved in an employment tribunal where he had in fact dismissed a special advisor, and I was insisting on him telling the truth to the employment tribunal, and he didn't respond well to that. So, I mean, yes, surprising and not surprising. It wasn't a pleasant place to work.
And I think it follows from what you say that those emails that we saw, in your view, absolutely are, if you like, evidence or a way in which we can gauge the type of toxic culture that you were and others were experiencing at the time.
It is also revealing of exactly the wrong attitude to the civil service, if I may. I was doing my job as a civil servant, and that I'm confident about that, and the way in which it was considered appropriate to describe what should happen to me, yes as a woman, but yes as a civil servant. It's disappointing to me that the Prime Minister didn't pick him up on the use of some of that violent and misogynistic language.
Well, that was going to be my next question, because Mr Cummings has been asked about the messages that he sent. But of course, is the point you make, which is that we have seen that Mr Johnson was a participant in not just that WhatsApp group, but plenty of others where this sort of language, that sort of abuse was used. And drawing on your experience in the Cabinet Office, what is your reaction to what appears to have been his failure to try and stop that sort of language, that sort of attitude prevailing?
It's just miles away from what is right or proper or decent or what the country deserves.
Let me go on, Ms MacNamara. We were talking about the solutions that were thought of to try and move on and improve the culture in Number 10 and Downing Street. And you explain in your witness statement, I'm not going to go to the paragraph, but you explain that at least part of the solution to those problems was to encourage people working in Number 10 and Downing Street to spend more time together so that they had a chance to develop, as it were, better relationships in that, no doubt, stressful environment. And in fact, you emailed Martin Reynolds to that effect, and at tab 27 of the bundle and 136760, we see this email. In fact, so it's the sort of lower half of the page. we can see, can't we, that this is in fact part of the drafting process of that note that the review document. And if we can look at the passage starting, I've suggested 2 messages, the paragraph. Picking it up 2 or 3 lines down, you say, "We also agreed that we would find ways for the senior team to get together on a social basis, provided it's within the guidance." And then, as it happens, you go on and mention your concern that guidance on safer workplaces isn't being kept to, and we've talked about that already. But is this a suggestion? This suggestion that the senior team get together on a social basis, is that part of this idea of trying to improve the culture in Number 10?
Absolutely. I mean, people had never met each other. So you had a whole load of people, a lot of whom were really brilliantly useful, who'd been brought into Number 10 as experts and specialists on various things, who were working with people they had never met. And I was particularly concerned that lots of these people sort of had no idea of the sort of tripwires in the organisation that they were working in. And I was confident that if we could just get people to talk to each other, that they might in fact be able to work better together. That has been the case everywhere that I have worked, and it was definitely true at this period of time. That was something I was very concerned about. People didn't know each other's names.
You add, of course, the important further thought that any such meeting should be within the guidance.
Of course.
And I want to move and look at a different document from very much the same time, which is at tab 24 of the bundle. It's another one of these documents relating to the drafting process of your review. It's actually an email. Yes, we have it on screen, 136754. And towards the bottom of the page, we can see this is a message from John Owen. So you were saying that he was Mark Sedwell's private secretary and the third person who contributed to the review. Mm-hmm. He's pleased with the draft. He says it's cheered him up no end to read, and he's put some comments in red. And if we could move on to page 4 in the document, please, we can see under Number 7, one of his sets of comments. Now, the subject matter of these comments is not really why I've taken you here, but what you are discussing is the question of whether, as part of this review, people should be encouraged to work from home or not. And in fact, this was another issue, another sort of theme of the draft review, which didn't make it into the final version, perhaps because the three of you couldn't quite decide what you, as a combination, thought about it. There were arguments both ways, were there not? But one of the points Mr. Owen was making, and we can see he's disagreeing with the idea that people should be encouraged to come into the office more. He says, "I fundamentally disagree with this. When we're telling the country to socially distance, it shows utter contempt to the electorate to openly flout those rules." Now, as I said, there are arguments both ways, and we see in the documents a discussion about whether, in fact, because of the ways of working in Number 10, it was important to be there. But that sentiment, that it was important for those working at the centre to take a lead and to provide an example to the rest of the country, I imagine is one that you agree with.
I agree that we should have been following the rules. Absolutely.
Just thinking about both of those then, the earlier email about trying to encourage more meeting and this point, what is your reflection, Ms MacNamara, on the fact that, as is very well known, there were a series of parties that took place in the Cabinet Office and in Downing Street in the weeks and months that followed these emails, including one on the 18th of June that you attended?
So this should never have happened, is the first thing that I would say unambiguously. And I've set out in my statement a lot more of my thinking and explaining why I did what I did at the time. Explaining is not the same as excusing. And I think that it is both incredibly depressing and actually helpful that people understand a little bit more now about what it was like to work in that organisation during this period of time, because there's a lot about the handling of when those the allegations of parties came up that I profoundly disagree with, and firstly and most importantly, lying about it. I don't understand at all why it wasn't acknowledged that on a number of occasions, I'm sure, that Downing Street and the Cabinet Office sometimes didn't follow the regulations. You will see throughout any number of emails between us all this endless conversation about, is it okay that so many people are in the office? What are we doing to try to limit the number of people in a meeting room? And some of the reasons, I think, why people thought they had to be at work so often, and definitely why I thought I had to be at work so often, is because it was my only mechanism of keeping any sort of control over what was happening. But we collectively got all of that really, really wrong. I would absolutely acknowledge that. The thing that I think has been particularly unfair about what has happened is it's allowed for a portrayal of a lot of people who worked really hard and did amazing work to be presented as something that, in my experience, they weren't. Now, I find it hard to talk about this because I wasn't there. I don't know how old I was at the time, but I definitely wasn't partying in Number 10. I was either at work or at home. And I think that acknowledging what had happened, acknowledging that some of it was a symptom of the situation, being honest about the fact that actually I would find it hard to pick a one day when the regulations were followed properly inside that building. And I know that because, as I've said in my statement, there was one meeting where we absolutely adhered to the guidance to the letter, and that was the cabinet meeting, and everybody moaned about it, moaned and tried to change it repeatedly. So I know how exceptional it was to really, really, really properly follow the guidance. And I think that in retrospect, obviously, all sorts of things were wrong. I think that I really hope that in addition to the investigation that was done into a specific subset of events, where I would also say I think events is one of those, or parties is one of those irregular verbs. So my glass of wine in the office with colleagues at the end of a difficult day is your event in the cabinet room, is their party. And I'm not sure how a junior civil servant working in Number 10 is supposed to be able to know the difference of where those lines are drawn. And I think that I really hope that there was also an additional piece of work done, which is to look at the entirety of what happened in organisational cultures across Whitehall during that period of time, and to try to understand why. And then how can you make sure that doesn't happen again? Because I think those are the civil service questions. Why did this happen? Why did this collective group of people decide to do things that are so clearly in the wrong place? And then how do we make sure that that doesn't happen again? And like I say, I hope that piece of work has happened, because I think it's really important. Because, this is the last thing I will say about this, but when the police drew the line at what was acceptable or not acceptable as I think it's called a birthday gathering, I'm not sure, in the cabinet room, when they said that was the wrong side of the line, I am certain that there are hundreds of civil servants and potentially ministers who in retrospect think they were the wrong side of that line. And I really hope there's been some mature conversation about that, because that sort of thing, if it's not addressed, is corrosive, actually, in a culture. And I hope that endless lessons are learned about this period of time, but some of them are about cultures and ways of working and supporting people and providing better infrastructure so mistakes aren't made. And when mistakes are made, owning them and saying sorry.
MacNamara, I want to take you back to one of the things you said, which is that you weren't there at the parties. Acknowledging the point you made about what we call those events.
Yeah.
But you were there at one of them, weren't you?
Yes, absolutely. Absolutely. I was in the office and I didn't think at the time, and this is again my own thinking and my own profound regret, and my profound regret is for the damage that's been caused to so many people because of it, as well as just the mortifying experience of seeing what that looks like and how rightly offended everybody is in retrospect. I've gone into some detail in this in my statement. I absolutely knew and thought it was actually important for there to be space for particularly the private office to be able to gather together and spend time together. And that was entirely because of the kind of culture that they were working in, and entirely because I was really worried about individuals breaking and suffering and whether they were going to be okay and how important their colleagues were to each other. And I just want to say again, I'm saying none of that in excuse of my own misjudgment, and I'm saying none of that in excuse of thinking any of these things were okay. But it was a much more complex situation than has allowed to be presented for lots of different reasons about, and I think it's mainly, I feel very strongly that it's unfair on the junior civil servants who are caught up in it.
Complex, but still those events shouldn't have happened, should they?
Not, of course, no, of course not.
You describe an institutional failure, really, but you were at the very apex of that institution, and so to the extent there was an institutional failure, that was, to a degree, your failure.
Yes. I think describing myself as the apex of that institution is probably overstating my role at the time, but I definitely, as a senior leader working there then, of course I do. And of course I own all of the other things that I wish now in retrospect I had done more on. You can't possibly go through this experience at the time and the time I've had to think about it afterwards without thinking, I wish I'd done a lot of things differently.
Ms MacNamara, let me move on to, if you like, a constitutional issue, which takes us back to one of the issues we noted at the very start of my questions. You'll recall that in that paragraph of your statement where you were summarising the preparedness or otherwise of the British government state for COVID, you referred to some unhealthy habits which the system had acquired during the year or two before. And one of those that we touched on was this habit of bypassing ministers in decision making. Take you to it, but you refer to the practice that developed during the Brexit discussions about ministers being put into reading rooms before cabinet so that they could see documents that they were about to be asked to endorse. Is that the type of situation that you're describing?
It is. It's both the... it's not uncommon, and I've worked with lots of different number 10s, it's not uncommon for number 10 to not be wild enthusiasts for cabinet government and collective agreement. So that's, in general, a point. It is definitely true that through the Brexit time, I do think Whitehall got bent out of shape in terms of cabinet government and ministers being treated properly and ministers being able to take decisions. I am pretty hard over as a civil servant, I think, on the importance of collective agreement and cabinet and ministers taking decisions.
You haven't referred to leaking. We heard from Mr Kane yesterday. We saw some WhatsApp exchanges where there was a pretty robust discussion between Mr Kane and Mr Johnson, I think it was, about leaking from within the cabinet. Names were named of people they thought were leaking material. From your experience, was this part of the explanation for why there was this desire on the part of the core decision makers, the Prime Minister and his team, to use a word, marginalise cabinet ministers?
So it's definitely an explanation. I don't think it's an excuse, would be my view. Although I would absolutely agree with them on the damage that leaking caused in terms of the quality of decisions that then are taken, because you are rushing at a gate in terms of getting a decision out. And I say that I think it's very important that there is good reporting of what government is doing. So it's not a kind of attempt to shut down journalists reporting things, but it is really, really corrosive when somebody decides to leak something ill-formed and then everyone has to rush about trying to come up with what the real answer ought to be in hours rather than days.
Let me just now focus in on the COVID period and what you say about this in your statement. So if we can go to page 64 of your statement, paragraph 129. You say here, at the time I was concerned about what I saw as a circumnavigating of cabinet governance, and you were increasingly worried that the cabinet themselves were not being given the full scientific picture or able to properly be part of accountable decision-making. And you go on to say that there was an asymmetry, and we will recall that one of your roles was briefing the shadow cabinet. There was an asymmetry in that at one point the shadow cabinet were getting more opportunity to ask questions of the CMO, Chris Whitty, and the CSA, Patrick Vallance, than cabinet ministers who were actually in the government. Is this the summary of that concern that you've just been describing?
Yes.
If we look just at a couple of documents to see, perhaps in practice, what was going on. First of all, if we look at tab 52, and it's a WhatsApp exchange, INQ 236371. Thank you. So this is a, have you got that?
Yeah.
So this is an exchange between, well, it's a group including Lee Kane and Dominic Cummings, and as we'll see, Martin Reynolds, from February 2020, so it's fairly early in the period. But we see Dominic Cummings saying there are lots of signs that containment has failed, we should now expect a proper pandemic, and needing to have an update for the PM. And if we go over the page, we see Martin Reynolds saying we've scheduled a ministerial meeting on Heathrow for first thing, so we can't have a meeting tomorrow, but we'll look to fix it later. And then he says, well, perhaps we could cover it at Cabinet or at the end at the National Security Council. And then if we skip down a couple of entries, later that morning we see Martin Reynolds, who perhaps by that stage has spoken to the Cabinet Secretary, saying Mark S., one assumes that Mark Sedwill, says he would prefer to do it at Cabinet, so let's fix that again. And he makes the point that Cabinet would be better, since it includes a wider cast list, including health and so on. And we see Dominic Cummings' response, no, Cabinet leaks. If there's bad news, it will leak straight out via some fool. That's a very bad idea. So it's a vignette, it's a WhatsApp exchange. But do we see there in practice the problem that you're describing, which is that the opportunity to discuss a serious development, to understand the science, to have input from that wide variety of sources that Cabinet provides, is being vetoed, in this case by Dominic Cummings, on his view, because Cabinet leaks and we can't, it's not a suitable body to have these discussions.
Yes, I mean, it's undoubtedly the case that did mean Cabinet probably didn't get the briefing it ought to have done, and it's also the case that things leaked from Cabinet just almost immediately.
If we just look at another document, this is tab 39, 308 305. This is a rather different situation, but perhaps the same basic point. It's an email you sent about we talked about the action plan in March. This is the roadmap, the plan for coming out of lockdown in May of 2020. And you are sending an email to Martin Reynolds, having had a first look at a draft. You've got various criticisms of it. But in the
Yeah.
first paragraph, one of the points you make, looking second line down, on a fundamental level, I don't see how this can be the recovery strategy without any debate or advice about the policy or choices contained within it, and without it being shared with government ministers. I think in your statement you say that it simply wasn't shared amongst the Cabinet in the course of drafting it. Is that another example of this problem that you're describing?
Yes, and it's worth, just in case this comes across as a kind of process nerdling, it's worth explaining why I was so bothered by it. One of the things that I think happened during the pandemic overall was that it became incredibly sort of, and I'm not a car mechanic, so I don't know if it's short-circuited or hot-wired or whatever it was, the ability for somebody to write something and then it to become a published document from the government was just so quick. And so there's two problems with that. Firstly, that you don't get, government's a serious business, and the boring work of going through all of the things that are on the one hand and on the other hand is important because it produces better outcomes when something is actually going to happen in real life. And also, as important, if not more importantly, the accountable people for the decisions of this government are people who've been elected. And I do appreciate it can feel a bit tedious to have to get them to agree, but it's not a get them to agree and tick it through. It's that they are accountable and they should be making the decisions on behalf of all of us who elect them. And it's not a bit of processology, it's a really fundamental point to the way that our country is governed. So it matters.
So that's if you like, a constitutional imperative.
Yes.
You've also mentioned that the process of cabinet government brings just a qualitative difference. Makes for a better decision. And if we can just look, please, at page 54 of your statement, paragraph 107. I think this is the point you're driving at here. Towards the bottom of that paragraph. And perhaps we're coming back to that point about breadth of experience and the real world experience that we were discussing in context of football matches. But picking it up about 8 lines from the bottom, if we can. You see there's a sentence in the middle of that line that says whatever. So whatever the personal experience of those in the room, and it was a pretty privileged set of people by any standard, there should have been a way of advising on implications for the whole population in the way that more normal civil service work would have allowed for. And then this, the full cabinet were better at bringing this wider perspective. They were a bit more grounded in consequences that were not as obvious and the complexities of the world as it is. The cabinet were not asked their opinion very often, and not on decisions in flight that I can recall. So is that, if you like, the point that about the quality of decision making that is lost if the cabinet are bypassed?
I think so, and it's also a point about the narrowed perspective, which I think is I presume we'll come on.
Yes, and we certainly will come to that. And I think you, at a different part in your statement, is it fair to say that you had a similar reflection about the Covid-0 group, being a rather narrow group and suffering from a similar problem?
Yes, and I happen to think that more elected people involved in decision making is better.
Let's move on, if we may, to a different, rather different, but still constitutionally flavoured issue. And for these purposes, I'd like to look at a paper that you were involved in drafting. It was dated the 22nd of May. It's tab 30, and it's 183934. Now, this is a document. The reason for going to this document, Ms MacNamara, is because of the proposals that you make about relations with the devolved administrations. Mm-hmm. There's obviously other points in this document, but that's why I'm asking you to look at it. And that is the front page with the Prime Minister's comments on the paper, which I'm not going to go to. But if we can go to the next page, please. We see the beginning of the note as it is, and without looking at it, we can remind ourselves that this was in fact a document drafted by you and Simon Case. Is that right? I think before he became Cabinet Secretary.
Yes, this is when Simon has just been appointed as the Permanent Secretary of the COVID Task Force, or what would be then the COVID Task Force.
And in summary, is this fair? That this is a document which is it is part of the process by which the arrangements within Number 10 and the Downing Street were rearranged, and in particular the MIGs were put to one side and replaced by COVID-O and COVID-S.
Yes, and also an attempt to, again, kind of restart government as normal, I think, which is why there's so many other cabinet committees also mentioned.
As I say, the particular focus for present purposes is on the question of how the devolved administrations were to be bound into this new process. Mm-hmm. And we can see in the summary of the document, in that bold passage at paragraph 1, 2 or 3 lines up from the bottom, that there is a proposal that we use the usual joint ministerial committee mechanisms to manage the DAs. Just note that word manage, and we'll come back to it, because there is, as one would expect, a further paragraph in the body of the document which gives us more detail on this issue, and that's paragraph 6 on the next page. And we can see that you make the point that so far the devolved administrations have been involved, first of all, by attending COBRA, and secondly, by being represented on the MIGs. And you say there needs to be a mechanism to discuss and agree on a 4-nation approach. In keeping with a move back to normal structures, you could convene a joint ministerial committee when needed instead. COBRA would stop meeting on COVID unless we re-enter a crisis situation. And then you talk about city mayors. And then, in bold, do you agree to use the JMC to manage conversations with the DAs and only COBRA if we re-enter a crisis situation? And I think Mr Johnson made it clear he hasn't sort of ticked or squiggled yes or anything, but in his statement he says that he agreed with this proposal. Mm-hmm. What did you have in mind when you said that joint ministerial committees could be convened in the normal way? Was this something that was going to happen weekly, monthly?
So I think that you're right to, manage is an uncomfortable word to see in the summary, and manage conversations is a in the actual draft is a better way of putting it. So I wasn't closely involved at this point in how conversations with the devolved administrations were going. I know that I had conversations with the CDL's team, it's the Chancellor of the Duchy of Lancaster, who about this note and about the proposals within it, and particularly the things that he was going to be asked to do. And my understanding at that point was that it was important that there were some sort of formal structures whereby these conversations could carry on. If we were closing down COBRA, not closing down COBRA, but for these purposes, not having devolved administrations involved in the replacement cabinet committees, because that would be odd, because it's not the way that cabinet committees work, then it was very important to have a mechanism for those conversations to continue in the normal way of things. So I'm more familiar, to be honest, with the way that the JMC ran in the coalition than at this point of time. I wasn't really involved in anything to do with managing relationships, but that would have been my expectation, and that would have been my assumption would be for the CDL to do mostly, but not only the CDL. I'd also been expecting that the Prime Minister and the First Ministers would also find ways to speak to each other.
What we know, again, in summary, is that, first of all, there were never any JMCs, at least that had as their purpose dealing with COVID arrangements. Secondly, there were regular calls between Michael Gove and the devolved leaders, but that during that period, the leaders of the devolved administrations repeatedly said that that wasn't adequate, that they were essentially just being, these calls were just being used to tell them what was happening rather than as a means of, to use your phrase, using a four nations approach to discuss what should happen. They repeatedly called for JMCs, which never transpired.
Okay.
Let me ask you about a passage from Mr Johnson's witness statement, if we can call it up. It's tab 35 in your bundle, page 45, 188. It's document 255836. So it's paragraph, yes. So this is a passage in his statement which has been subject of some consideration at the inquiry. But this is a response by Mr Johnson to the suggestion that there should have been JMCs during the pandemic. He says, it is optically wrong in the first place for the UK Prime Minister to hold regular meetings with the other DA First Ministers as though the UK were a kind of mini EU of four nations and we were meeting as a council in a federal structure. That is not, in my view, how devolution is meant to work. Do you see any tension between your proposal in the document that we were looking at, your expectation, and that statement by Mr Johnson?
Yes.
Can you expand on that?
So I don't think I was aware in making that proposal, and I'm saying this hesitantly because I just don't have much memory about why this was here. It would have been a standard. If you're not going to engage with the devolved administrations in this way, then you must engage with them in that way. And I probably wasn't thinking about it in a more sophisticated way than that. This is obviously entirely different. I did know that was Mr Johnson's view towards the governing structures of the United Kingdom. And I also knew that the personal, the kind of personal politics between him and the First Minister in Scotland, in the way that it was played back to me, I never saw it firsthand, was such that that had been a thing that people talked about as being difficult in the first phase. So I suspect that this was a way of trying to go back into a more normal pattern. I don't think it would have occurred to me that there wasn't going to be any JMCs after that.
Whatever you call the meetings, were you expecting a substantive process of discussion and consultation to take place across the four nations looking forward?
I was expecting close working is probably the better way of putting it. That would have been my expectation, is a continuation of close working, which is not only at ministerial level. So I know that the respective CMOs of the four nations also met regularly, and I would have been expecting those sorts of the kind of close working while respecting the devolution settlements to continue.
Yeah. Yes, thank you. We can take that down. I want to move on to just another short topic, and that is about the Health Secretary, Mr Hancock. Would it be fair to say that he was one of those people who you worked with fairly closely during the period of the pandemic?
So I will have seen him in the formal meetings,
Yeah.
yes.
But regularly?
Very regularly, yes, but as part of the kind of, as a member of the Cabinet or
Yes.
as a member of the committees, yes.
You worked in the Cabinet Office?
Yes.
He worked in the Department for Health, so
Yes.
There was clearly some distance there.
Yeah.
But equally, he was very involved in the response to the pandemic, and you saw him in meetings.
I'm sorry, I didn't mean to be... I probably was in a meeting with him once a day at various points. Yes, you're absolutely right.
All right. I want to take you to 2 or 3 passages in your witness statement. First of all, page 20, please. And it's that paragraph at the top. We went to it earlier this morning, just to remind ourselves. You explained that one of the reasons that you were confident that the plans for the pandemic existed was simply because Mr. Hancock, time and time again, in your words, and as you've explained this morning, without any ambiguity, assured the Cabinet that they were there. And would it be fair to say that you were surprised, let down, when you realised that what he had said wasn't actually true?
I was surprised, yes.
Let me ask you about another passage, just going forward a few pages to page 58. At the very bottom of that page, paragraph 117, you say that through April, it became obvious that the confidence number 10 had in the machinery in the Cabinet Office was in sharp decline. Excuse me. There were also increasing questions about the performance of DHSC and the Health Secretary, where the issue was a lack of confidence that what he said was happening was actually happening. You say that the two were related. And then this, the usual systems of governance in Whitehall rely on people being truthful. The sense of this part of your statement seems to be that people working in government at the time didn't trust Mr. Hancock. They didn't believe that what he was telling them was true. Is that a view that you held?
So it's definitely the view in government. It is, I think it's fair to say it was what we experienced, so that what was said in a meeting as actually being under control or going to be delivered or something that was fine, that then subsequently, a matter of days sometimes, or sometimes weeks later, we discovered that that wasn't in fact the case. So I think it's quite hard to say, absolutely it wasn't the situation where, I don't recall anyway, a situation where it was black was white, but definitely a pattern of being reassured that something was absolutely fine and then discovering it was very, very far from fine. And that again is sort of unusual in a cabinet, inside Whitehall, in a cabinet committee or cabinet government situation. You don't usually get that. You don't usually get everything's okay, and then 2 weeks later, not only is it not okay, it wasn't even there. That's very, very unusual in my experience. And so this is my point, that not only was that a problem, but why wasn't the Department of Health, why wasn't there anybody who was able to say, actually, it's not quite like that? And my experience is that we didn't get those signals through from the department. We didn't get a sense that actually what we were being told might not be right. And then that also then led to, I would have thought reasonably, a concern that the processes and structures that we'd put in place in order to create any accountability were in fact not really working, because things turned out not to be the case very quickly afterwards.
Yes, there was an issue with processes, structures, the Department for Health. But does it come back to the fact that Mr. Hancock regularly was telling people things that they later discovered weren't true?
Yes.
One more passage on this, Ms. MacNamara, and that's page 39 of your statement. It relates back to that period, that very tense and difficult period just after you came back to work in April. And in fact, you can see at the beginning of that paragraph, you say it was a fragile time. And in this paragraph, you describe being inside, as you say, the eerily empty number 10, partly perhaps because everyone was off with COVID. But Mr. Hancock had recovered and was back. Excuse me. You say you were pleased to see him recovered. You talked about your respective experiences. And then you say you remember trying to reassure him that he didn't need to be in the office, especially not in number 10, and saying that it must be very hard. As Health Secretary, he could not have imagined the enormity of the decisions he would be involved in when he was appointed. And given, as you say, that it was a long way from the Dane job, you wanted to know if there was any more help or support he needed.
Yes.
And then you've included in your statement this account and also his response, which is, he reassured me that he was, quotes, loving the responsibility, and to demonstrate this, took up a batsman's stance outside the cabinet room and said, "They bowl them at me, I knock them away." This is a intriguing exchange that you've chosen to include in your statement. Are you trying to tell us something about your assessment of Mr. Hancock's character or the way he was doing his job?
I'm trying to explain just how jarring some of that was and how different places, lots of us who were all theoretically in the same place that we were. And it does partly go back to my point about kind of nuclear levels of confidence that were being deployed, which I do think is a problem. And it really stuck with me, this moment, and I thought I have tried throughout this statement to give you the most honest and best account I can of what it was like to be there, because I think that's the best service that I can do in terms of you being able to come to some conclusions. So it was important to me at the time, so I felt it was important to include in this way, but it's more a point about confidence than anything else.
Confidence or in fact, overconfidence?
I think overconfidence, yes, is completely... yes, overconfidence. And going back to my humanity point, I think that this failure to appreciate all the time that what we were doing was making decisions that were going to impact on everybody's lives, and that meant lots of real people with real consequences. And I don't think there was ever enough attention paid to that.
You were trying to engage with Mr. Hancock about the incredibly onerous scope and impact of the decisions he was going to have to be making, the impact on the lives of everyone in the country of those decisions. And he thought he was playing cricket.
Well, I assumed it would be weighing heavy on his shoulders. He may well tell you that it was, and he felt it was important to project something else instead. I don't know. I just know how I experienced that.
Mr O'Connor, are we going to finish with Ms MacNamara before lunch?
We're not, my lady. I have another...
In which case, it's been a long morning for you. I think we'll break for lunch now, and I'm sure the stenographer would also be grateful for a break. 5 to 2, please.
All rise.